Well, hello everyone. Today is procedure day. It was an early morning. My husband started messaging me at 5:40 in the morning. Maddie had to be checked in by 6 a.m. She's already in there. They're working on her. And that's microwave. That's Flynn's breakfast. So we are going through this thing where most hospital food tastes terrible to Flynn. It's bland. And so he's been craving things like fried chicken, pork lo mein. So my husband brought some pork lo mein, but we have to microwave it for 2 minutes. I'm about to bring it into him. And then I think Jaron and Flynn are gonna meet me up here in the family kitchen to eat some breakfast. Hopefully they bring some coffee because that is out already. Here, I thought it was funny. I was chatting with one of the dads here. Our fridge is full of coffee creamers. You know, everyone's got to have their own flavor. All right, I'm gonna go bring Flynn his breakfast of pork lo mein. And then I thought, if Brandon and Jaron are here, I'll talk about the procedure and what it entails. Okay, we're eating breakfast here. Brandon's gonna head off in a bit to go be with Maddie. Jared's either gonna stay in here and watch football or come and do homework. What do you think? Or football. Football. All right, let's do bacon and pancakes. Okay, talk to you guys later. Okay, so I'm gonna quick explain the transplant. Currently right now, Maddie is in the procedure. I think she's got about an hour left. And that is where she's put to sleep. She's laying on her tummy, and a couple doctors, 2 or 3 people will be in there. Well, actually, there'll probably be a lot more than that. But a few people that are actually using a syringe and going into a soft spot of her hip bone and taking out her marrow. She has 2 hips. There's going to be 2 syringes going at the same time. And I think they said they have to get 1.5 liters, which will be about 100 withdrawals. And she will be in there for about another hour. Right now, Flynn is just laying in here, eating some lo mein, listening to his IV pole beep, and Brandon's here too. Like I've said before, we can only have 2 people in the room at a time. Jaron is in the family room doing his homework and watching ESPN. Then they have to take those cells to a lab, and I was listening on the rounds this morning, and there is something inside of Maddie's blood. Just a sec here, we're beeping. So because Maddie is older and heavier and a bigger person, her blood has more heparin in it, and so they are going to either take it out and they'll do some kind of laboratory procedure, or they're going to give him a different medication to anti-affect the presence of extra heparin. I'm not sure. The nurse came, turned off the beeping. So let's see, where are we at in the procedure? So I said they take Maddie's marrow out, and it'll be about an hour. I guess it's an hour to set up, an hour for the procedure, an hour for cleanup, send her on her way. And in which case, Brandon will go and meet her and wait for her to wake up. Then the marrow is going to the lab, and they're going to do something about those ephrins, whatever that is. And then, this is the part that is crazy. They're going to take her marrow. I guess it's going to be in like one of those IV drip bags, some kind of container like that. And they're going to bring it right into this very room, and they're going to hang it on Flynn's IV pole, and they're going to put it in his PICC line, because remember, he has that little port they put, and that goes right into his blood veins. And they're just going to put it in. It's going to be 2 hours of dripping it into him. Now, this is the amazing, miraculous thing about it. Somebody before, when it was describing it to me, said that it's magical, but this is the miraculous thing about it. That marrow that Maddie has finds its way into Flynn, into all the right places that it needs to go once they've sent it in there. And then his body is supposed to look at that marrow and be like, oh, okay, this is the healthy marrow. This is what we're supposed to be doing. Should be making marrow like this, not how it has been. And then they're going to use Mady's like a recipe. And then his body, for the next couple weeks, is going to have to keep her marrow in, acclimate it to his body, and start making his own. And then, of course, they're going to give him anti-rejection medicine and graft versus host disease, where to keep her marrow from wanting to kill him. Yeah, and so that's the miraculous part, is like they just stick it right in him. There's like no surgery. It's not like, you know, if you're going to do like kidney transplant. They just, I mean, the surgery, if you will, the procedure is happening to Mady. But Flynn will be, I think I'll walk over here and show you guys. He'll be laying right here in this bed, and then they'll hang her marrow right up on that pole. Now, I don't know how much of it I'll show you. I might take a little clip while he's getting it. But it's going to be a busy room, they said. They're going to have a doctor in here. They're going to have Marin, our nurse, who I think is a new nurse and is being trained by another nurse. They're like a little pair. But yeah, that is the plan for today. Right now it's 9:30, so we've got another hour before Mady will be done, and 5 hours or so before Flynn will be receiving. Do you have anything you want to say? Do you want to say hi to any of your buddies in case anybody at school? Hey, you guys. Well, we're all here. Here's Jer, the back of him.
Hi, guys.
There's Mady. She's coloring in her hospital hoodie. There's Brandon, and then way on the other side of Brandon, Flynny, can you pick your head up? So we're all here together for the first time in one room.
Yeah.
In like 2 or 3 weeks. Mady just woke up. That's why she's in that cool chair. And they wheeled her down from donating her cells. That's what the hospital people call it. They don't call it bone marrow. Her cells. And now we're just waiting for them to do their thing with that, so that they can put it in that IV pole way over there. Yeah, so that's all we're waiting for. Mady did a great job. She's alive. She was cold. We bought her a children's hospital hoodie and a cat. And Jer's playing football on his phone. And I am crocheting. Okay, well, that's all for now. We're just waiting for them to process the cells. Okay, everyone. See you in a while. I'm trying to get there. This room is really messy, hey? Okay, so after hanging out for a while with the family in here, and yes, they did break the rules to let all 5 of us be here. At 1:30, they brought down Mady's cells. That's what they're calling her marrow, her blood work and whatnot. And I'll put in some pictures. I think I have a picture of them looking over it to make sure, checking, verifying who the donor was and who it's supposed to be to. You know, double checking to make sure they don't accidentally put somebody else's marrow in someone else. And then I think I have a picture of the IV pole. And then basically, here, let me put in those pictures. Yeah, so then basically it was scheduled to be like a 3-hour drip, like through his IV pole, just like his medicine. And the 2 nurses had to stay in the room the whole time. After about an hour, Mady was like, get me home. I want to go into bed. I want to go home. So Brandon packed up the Ronald McDonald house, packed up the car. Then he came back. He got Mady. We hugged and he left. And things were trucking along pretty good. Towards like the end of the 2nd hour, Flynn started having really high blood pressure, 150/40. And so they started, and the doctor just explained that simply he was getting more fluid in his body than, obviously, I mean, all that marrow is fluid. It's like blood. And that was causing his heart to have to work harder to pump it all. So they gave him a medicine to lower his blood pressure, which made him pee right away, like 2 or 3 times to get more fluid out of his body. I was like, shoot, couldn't come out of the fat leg, but whatever, because that's lymph fluid, but no, they just got urine. So they were able to, they stopped the transplant to get his heart rate under control, to get his vitals and everything all in the normal range. And then they started the transplant again. So the reason we had 2 nurses in here is one of them, I think, is training. I mean, she completed her nursing school, but I'm thinking she has to job shadow for a while. So her partner nurse was here. And so they were here until like 6:45 with him. So they restarted the transplant of putting in Maddie's cells. And then that was good. He was finished. Everything was fine. But then he got like a terrible headache. So they brought in, gave him some Tylenol, gave him an ice pack. We're looking at his eyes. They had him, what did they call it? They gave him a neuro exam. That's where he squeezes their hands and kicks with his feet and pushes just to make sure everything's going fine. Then they were able to get his headache under control. And then he started having tremors. Yeah. And that would just be like if he lifted up his hand, if he picked up his arm, or if he had to hold something, he was tremoring. So while they called in another doctor for that, I guess the main doctor had gone home for the night. Interestingly enough, he was trying to figure out why he was having tremors. He was going to take some more blood, look at his electrolytes. But my husband figured out the reason. And he is able to log into my chart from home. And he looked at the list of medications that they put Flynn on and found that one of the medicines that they put him on causes tremors. So when the doctor came back, I said, my husband, I just told him what I told you. You looked it up, blah, blah, blah. And he said, the Treco causes tremors. Do you think that could be it? And he's like, oh yeah, you're right. That could be it. So, but otherwise, it was a pretty, once we got the blood pressure under control, the tremors, we figured out why those were happening. And it doesn't happen if he doesn't like raise his arm or leg. If he's just laying there doing nothing, it don't happen. And then finally, before bed, we got him all wiped up. We're trying to get him ready to go to bed. He starts having nausea and throws up all his nightly medication. I know, the poor thing. And because he'd only had it in there for a little while, they reordered all of his medicine and he had to take it again. I know. So after that, he was able to sleep through the night. I was able to sleep through the night on that terrible little bed over there. And we woke up this morning and he still has a little bit of a tremor. He threw up again after taking his medicine, and he is pink. He's pink all over. He looks like he's warm, and they said that's just the infusion of more red blood cells. But otherwise, yeah, we're just in this is a new phase of how the next couple days will be. He'll have bouts of nausea. He may throw up his lunch or his medicine. They'll just give him more medicine. And yeah, the nurses are real great at cleaning it up, taking care of everything. Flynn can feel it coming on, so we're able to get him one of those little basins to puke in. He doesn't get it on his clothes or his bed. He's a big boy, so that aspect of it's nice. But overall, we're just, we're just waiting to go through the next few days. I'll attach these with the videos and the pictures from earlier, and that will be, the transplant day. It was a very long, stressful day. So, yeah, we'll see how this next day goes. Okay. Thanks for watching and praying, everybody. We felt a lot of love and support from our school and from our family members yesterday. And Maddie is home and doing well. All right, bye.